Functional strength exercises become increasingly important after age 60 for maintaining independence and preventing falls. Today we're focusing on 3 fundamental movements that support daily activities: chair sit to stand, heel raises, and seated leg extensions. These exercises target essential muscle groups and movement patterns needed for walking, standing, and daily mobility. When practiced consistently with proper form, they can help maintain strength, balance, and confidence in movement. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before starting new exercises, especially if you have recent surgery, joint problems, cardiovascular conditions, or balance disorders. Understanding functional strength for daily living. Functional strength exercises mimic movements you perform daily, making them particularly valuable for maintaining independence. These movements include standing from seated positions, maintaining balance during weight shifts, and controlling leg movements during walking. After 60, maintaining these abilities becomes crucial for continued independent living, fall prevention, confidence in daily activities, and quality of life. The 3 exercises we'll cover today address these essential functions through safe, accessible movements adaptable to different fitness levels. Exercise 1. Chair SITTO. Stand for lower body strength. The first exercise is chair sit to stand, which builds strength in quadriceps, glutes, hamstrings, and core muscles while training the essential movement pattern of rising from seated. This movement directly supports daily activities like getting out of chairs, rising from toilet, standing from bed, and entering/exiting vehicles. Here's how to perform chair sit to stand safely. Choose sturdy chair without wheels, preferably with armrests. Position chair against wall if it tends to slide. Stand facing away from chair with feet hip to shoulder width apart. Slowly lower yourself to seated by bending knees and hinging at hips. Keep chest relatively upright and back straight during descent. Lower until seated fully on chair. Pause briefly in seated position. Press through entire feet, especially heels, to stand back up. Use leg muscles as much as possible, minimizing arm assistance. Stand fully upright at top. That completes 1 repetition. Start with 5 to 8 repetitions. Rest briefly between sets. Complete 2 to 3 sets. Progress gradually by increasing repetitions to 10, then 15 over weeks. Important technique reminders: lower slowly with control, never dropping into chair. Keep knees tracking over toes, not collapsing inward. Maintain upright torso, avoid excessive forward lean. Breathe naturally, exhale during standing phase. Use arms minimally for balance support only if needed. Modifications: for limited strength, use chair with armrests and assist with arms as needed. Place firm cushion on chair seat to reduce depth required. For progression, use lower chair or cross arms over chest to increase difficulty. Practice near sturdy support for safety. What to realistically expect: with regular practice 3 times per week over 4 to 8 weeks, you may notice stronger legs for standing tasks, improved confidence rising from seated, easier daily transitions, and enhanced lower body functional strength. Sit to stand strength directly translates to improved independence in daily activities. Exercise 2. Heel raises for ankle strength and balance. The second exercise is heel raises, strengthening calf muscles, improving ankle stability, and supporting balance. Strong calves and stable ankles are essential for safe walking, maintaining balance during weight shifts, preventing ankle injuries, and supporting proper walking mechanics. Here's how to perform heel raises safely. Stand beside or behind sturdy chair or counter, holding with one or both hands for balance support. Position feet hip-width apart with weight distributed evenly. Stand with good posture, chest lifted, shoulders relaxed. Slowly rise up onto balls of feet, lifting heels off floor. Lift to comfortable height, focusing on controlled movement. Pause briefly at top position, feeling calf muscles engage. Slowly lower heels back down with control. That completes 1 repetition. Start with 10 to 12 repetitions. Rest briefly. Complete 2 to 3 sets. Progress gradually to 15 to 20 repetitions as strength improves. Critical form points: move slowly and controlled throughout, avoiding bouncing. Keep movement smooth and deliberate. Maintain balance through support, don't test balance during exercise. Keep body upright, avoid leaning forward or back. Distribute weight evenly across balls of feet. Breathe naturally throughout movement. Modifications: for balance concerns, hold support continuously with both hands. For limited ankle mobility, lift heels only partially, even small range provides benefits. For progression, once basic version is mastered, try single leg heel raises holding support. Reduce support gradually as balance improves. What to realistically expect: with regular practice 3 times per week over 6 to 10 weeks, you may notice stronger calf muscles, improved ankle stability during walking, better balance during daily activities, and enhanced confidence during movement. Ankle strength and stability are foundational for safe walking and fall prevention. Exercise 3, Seated Leg Extensions for Quadriceps Strength. The third exercise is seated leg extension, strengthening quadriceps muscles at front of thigh. Strong quadriceps support standing from seated, climbing stairs, walking stability, and proper knee function. Here's how to perform seated leg extensions safely. Sit upright in sturdy chair with back support. Position yourself so back rests against chair back. Place feet flat on floor with knees bent at 90 degrees. Hold chair sides or armrests for stability. Keeping torso upright, slowly straighten right knee, lifting right foot off floor. Extend leg until knee is relatively straight or as straight as comfortable. Foot should be flexed with toes pointing toward ceiling. Hold extended position for 1 to 2 seconds, feeling thigh muscle engage. Slowly lower leg back down with control. Return foot to floor. That completes 1 repetition with right leg. Perform all repetitions on right leg before switching to left. Start with 10 to 12 repetitions per leg. Complete 2 to 3 sets per leg. Rest between sets. Important technique reminders: keep torso upright and stable, don't lean back excessively. Move legs smoothly without jerking or swinging. Control both lifting and lowering phases equally. Extend knee to comfortable range, full straightness not required. Breathe naturally, don't hold breath. Modifications: for limited strength, extend leg only partially rather than fully straightening. For knee discomfort, reduce range of motion to pain-free range. For progression, pause longer at extended position or add light ankle weight. Perform exercise slowly, focusing on muscle engagement. What to realistically expect: with regular practice 3 times per week over 6 to 10 weeks, you may notice stronger front thigh muscles, improved leg control during walking, easier stair climbing and standing tasks, and enhanced functional leg strength. Quadriceps strength is essential for many daily activities requiring leg power and control. Creating functional strength routine. Here's how to integrate these exercises into effective routine. Practice all 3 exercises in sequence, 2 to 3 times per week. Sample routine: chair sit to stand, 2 to 3 sets of 5 to 8 repetitions. Rest 60 seconds. Heel raises, 2 to 3 sets of 10 to 12 repetitions. Rest 60 seconds. Seated leg extensions, 2 to 3 sets of 10 to 12 repetitions per leg. Complete routine takes 10 to 15 minutes. Allow at least 1 rest day between strength sessions for muscle recovery. These exercises can be performed together as complete routine or distributed throughout day as convenient. Integrating exercises into daily activities. One effective approach is anchoring exercises to existing daily activities. Perform chair sit to stands when getting up from meals or after reading. Practice heel raises while waiting for kettle to boil or during TV commercials. Do seated leg extensions before or after reading newspaper or during phone calls. This integration makes exercise effortless part of daily routine rather than separate task requiring motivation. Consistency through integration often produces better long-term adherence than scheduled workout sessions. Essential safety considerations: these functional exercises are generally safe but require appropriate caution. Stop any exercise causing sharp pain, joint pain beyond mild muscle fatigue, dizziness or lightheadedness, or significant increased discomfort. You should consult healthcare provider before beginning if you have recent surgery, particularly joint replacement within past 6 months, severe arthritis with constant pain, uncontrolled cardiovascular conditions including high blood pressure, significant balance disorders or frequent falls, or acute injuries. Always use sturdy support for exercises requiring balance. Practice on non-slip surface wearing stable footwear or non-slip socks. Keep exercise area clear of obstacles. Have chair or furniture nearby for support during standing exercises. These exercises work best combined with regular walking as tolerated, proper nutrition supporting muscle health, adequate rest and recovery, and other healthy lifestyle practices. Realistic expectations for functional strength improvements occur gradually with consistent practice. Weeks 1 to 4, learning proper form and technique, initial muscle soreness which is normal, beginning to establish routine, some may notice slightly improved confidence in movements. Weeks 4 to 8, exercises feeling more natural and controlled, noticeable improvements in strength, ability to progress repetitions or difficulty, improved ease during similar daily activities. Months 3 to 6, clear improvements in functional strength for daily tasks, better confidence and independence, established sustainable routine with continued progress, enhanced quality of life through maintained capabilities. The goal is gradual sustainable improvement supporting long-term independence, not rapid dramatic change. Monitoring functional improvements: track progress through real-world functional improvements rather than just exercise performance. Notice if you can rise from chairs more easily without arm assistance, stand from low seats with better control, walk with more confidence and stability, maintain better balance during daily activities, and feel more capable during routine tasks. These functional improvements indicate meaningful strength gains supporting your independence and quality of life, which are ultimately more important than exercise numbers. Progression principles: progress exercises gradually using these principles. First, increase repetitions within comfortable range. Once you can comfortably complete 15 to 20 repetitions, add additional set. Once multiple sets feel manageable, increase difficulty through modifications like lower chair height, reduced support, or longer holds. Always prioritize proper form over quantity or difficulty. Poor form with high repetitions provides less benefit and higher injury risk than proper form with moderate repetitions. Listen to your body and progress at pace appropriate for you. Importance of consistency: functional strength maintenance requires consistent practice. Muscles respond to regular stimulus. Practicing 2 to 3 times per week consistently produces better long-term results than sporadic intense sessions. Missing occasional session is normal and acceptable. Simply resume routine when able. The goal is sustainable long-term practice supporting continued independence, not perfect adherence. Consistency over months and years maintains functional strength supporting quality aging. Conclusion: these 3 functional exercises, chair sit to stand, heel raises, and seated leg extensions, provide foundational strength training supporting essential daily movements. Sit to stand builds lower body strength for rising from seated positions. Heel raises strengthen ankles and calves supporting balance and walking. Seated leg extensions strengthen quadriceps essential for leg control and power. Start at appropriate levels using all suggested modifications. Practice 2 to 3 times per week consistently. Progress gradually based on how your body responds. Use proper support for safety always. Listen to your body and stay within comfortable ranges. Combined with regular walking and healthy lifestyle practices, these functional exercises can help maintain strength, independence, and quality of life. Thank you for watching. For specific concerns about appropriate functional exercises for your situation, consult with a physical therapist or healthcare provider for personalized guidance. Subscribe for evidence-based information on functional fitness and strength training for older adults, practical guidance prioritizing safety while helping you maintain independence and capability for daily living.